Welcome to Saltwater Reasonings, a listening library for critical conversation, reflection, and collective knowing across the global south. Today I am joined by Pamela Wudende, a developmental psychologist and developmental scientist based in Kericho, a tea growing region in Kenya. Pamela and I know each other through the Pan African Mental Health Research Network, a collective of researchers working across the continent and across salt waters to include colleagues in the UK and the Caribbean. We are committed to research that takes Indigenous knowledge systems seriously, centers community agency, and treats ethics as practice rather than paperwork. That grounding shapes this reasoning. Pamela takes us back to her beginnings as a teacher and shows how the daily practice of paying attention, noticing patterns, and staying curious becomes a research disposition. From there, we move into her approach to multidisciplinary and mixed methods work and her consistent commitment to reduce power relations in the research encounter. We talk about method, power, and epistemic responsibility. We reason about qualitative inquiry as a way of listening for lived experience, about Indigenous education as inherently holistic, and about what it means to stand in the middle, translating without flattening, and making research locally grounded while still internationally legible. If you are thinking seriously about community accountability and researchers' relationship, this conversation will give you language and it will give you practice. Let's get into the reasoning. It's so beautiful to be in conversation with you. Welcome. I want to start by asking you to share your emotional and your physical location. It's morning where I am, it's afternoon where you are.
Thank you. First and foremost, thank you so much for having me, Tracy. This is such a honor and a privilege. And I always tell myself, when you wake up in the morning, sometimes privilege just follows you, and this is one of it. So thank you so much for having me. I'm in Kericho, Kenya. It's a western part of Kenya, the tea growing part of Kenya. So, it's 3 p.m. in the afternoon. So I've gotten a chance to wake up in the morning and go and walk in the tea, a really refreshing walk. So right now, emotionally, I'm on tip-top condition, really, really brand new and fresh, really good.
It is 7 a.m. where I am, and I have my tea. Unfortunately, there are no tea fields in Kingston, Jamaica.
Right.
But I'm here with my tea this morning and so happy to be in conversation with you. Yes. So today I really want us to delve into your work and how you came to your work.
Let me just say who I am and how I came to be doing this, because I think that's a really important background information about what I do. And it really, for anyone to listen and understand why I do this, what I get out of it, what I bring into it, is important to go back. So, one, I am a developmental psychologist, basically a developmental scientist working in the area of mental health and emotional health. The two separated by one, mental health being more long-term and emotional health being more responsive to stimuli. So how you respond day to day, but mental health being, really long-term. So I work in this area, and especially with children. And the reason I really like working with this age group is that for any community, they represent the future. So you can tell how a community is going to look by looking at their children. And you can tell the kind of values the community has by looking at how they treat their children. So I choose to work in that area just because of these two things, because this is the future and this is what the community values more. The community cares about continuity. The community cares about what kind of values it wants to go into the future. So that's basically what I do. I've worked in this area for over 20 years. And I started off as a teacher. I love teaching. Teachers were always my role models, because I would look at teachers, and to me, they were the kind of people who were open to suggestion. They were open to suggestion. They were ready to learn. They were ready to find out what was there behind the curtain. And that really attracted me as a child. So growing up, I just wanted to be a teacher. So I started off as a teacher in school. And that's where this kind of research trajectory started off. In my teaching career, I taught language, and I realized that children were really struggling to acquire, especially the English language. The local languages, Swahili language, was fine. Children would come to school in rural areas in Kenya. Children come to school, and the first 3 years, they should be taught in the local catchment area language. So they were fine. A child would come in a rural area, they would learn about one being a chiel, and they would be fine. But immediately they moved to the classrooms where they needed now to start learning the same thing in English, they start struggling. And a lot of research was done, and just give you the most recent one being the one that was done and regionally in 2014, which found out that children in grade 8, that is after 10 years of schooling, 4% were still at the level of reading and writing of grade 2. Now that is a disaster. It's such a waste of so many years and not learning something. So, these are some of the reasons why I went into research in these rural areas to find out what could be the problem.
Two things jump out at me. How being a teacher and having curiosity flows so naturally into the work of being a researcher. And teachers actually are researchers. And then this change, that statistic is so powerful that after 10 years in school, children are not progressing. And tying that into the community values around education and continuity. So it's hard not to see that. But Pamela, a lot of people see it and don't see it. So what made you say, I can't unsee this?
You can't unsee that because of the kind of value, how important education is to these communities. Why? Because traditionally we had indigenous education. That was life or death. You had to learn something. You had to learn to be able to live in the community. Now, when this Western kind of education comes and tries to replace some aspects of the indigenous education, people still see education as important as it was even during that time. So if a child is to go to school, they should succeed. The same way, if they were to stay at home and learn in the home settings, they were supposed to succeed. Remember, if you did not succeed in learning things, how to live in the community, you didn't survive. It's about
Right.
survival. So that's how important it was. I couldn't unsee that. That's how important it was to me.
Wow.
Yeah.
So you start off there. So tell us about education to now a developmental psychologist,
Yes.
and how that morphed into other things.
From there, I used to, as you say, rightly say, teachers are researchers. So I would find out, why are my students not getting these concepts in English? Why is it so hard for them to, why is it much easier for them to get it in their local language, in the home settings? They do the same things. For example, they count plates in the home. Your mother tells you, go to the kitchen, bring 3 plates. None of them brings 2. They all bring 3. But how come when now they come to school and you say 3 plates in English, it's so hard for them to understand? So, these are the things that I started thinking about. And even before then, I started thinking of, what are the possible ways of using how children are motivated and taught at home in school settings to ease their transition from home to school? I realized that one of the undoing, one of the things that made this such a hard time for children to move from home to school is that the motivational ways are so different, very, very different. Whereas at home, the education is so holistic. Everything is bunched together. You learn how to count by cooking, washing utensils, taking care of animals, doing this. You learn how to count. Your chicken has 6 eggs. No one confuses that with 4 eggs. No child confuses that. They know 6, 7, 8, and so on. So the way they are motivated and taught at home is so different from the way they're motivated and taught in school. In school, when they arrive, now there is a subject called math. Now there's a subject called language. Now there's a
Yeah.
subject called hygiene, and so on. Math is different from language, it's different from hygiene, yet at home it's the same holistic thing. So it's the same thing, but the way it's presented is so disorienting. So I'd even started thinking about that. So I always believe But as I said, I like teachers, and I really admired them because they were open to suggestion. And I always believe, why is it's important for me to learn how the other person thinks before I can relate with them. So I had my undergraduate in Kenya, my master's degree in Kenya, but I did my PhD in the US. And that opened a whole world to me. And I was like, oh my goodness, there are different ways of thinking, and it doesn't mean they are right or wrong, but it's just different ways of looking at things. And I'm forever grateful. And as I tell you, I feel privileged for having gotten those kinds of exposures. Not everyone gets them, but it really allows you to look at things from different vantage points. How, for example, would a person who born and brought up in the Western world look at this? And how would this person, like me, born and brought up in Kenya, look at this? And then you find a middle ground, how to talk to these two people. And that's the privilege I think my education gave me.
You have a multidisciplinary background, right? So I'm now hearing about your teacher origins. Well, you have psychology, you have sociology, you also have public health. When
Yeah.
you come from such a multidisciplinary place, how do you decide which method is appropriate for which research problem? What is your internal process?
Yeah. First and foremost, African indigenous education was multidisciplinary by nature. That you children in the home learning hygiene, language, and everything else in there, health, everything else in there. So I think this is a natural place for me to come from. It's really it's something that is out there for me. I'm already in there. And then about the methods I choose, I normally just look at which of these methods will help me get the information from participants in a way that first and foremost cuts down on the impact of power relations. For example, diminish me so that
Yes.
I don't look like I'm talking down on people, and then
Mhm.
elevate them as the owners of the knowledge, as the ones who are teaching me. Because being a researcher, I believe you know that at any one research project, you are learning much, much more than you are teaching anyone. You're not even teaching anyone, you're learning more than you're teaching anyone. Many times I go for qualitative methods, observations, interviews. And I really esteem phenomenological research designs that allow me to hear the lived experience of this person who is going to tell me what they know, and I'm going to learn from them. So that's how I choose that. Whether it's in health, because I know health being so positivistic, people want to have these measurement tools where they're going to say one, two, three people said this, three did not say this, 0.5% ABCD. No, whether it's that, anytime I join a research collaboration, I'm normally leading on the side of qualitative research so that I collect the stories, I collect the people's lived experiences to complement the information collected in numbers. Yeah.
Yeah. I want to ask you about indigenous methodologies, and you've been talking about it. And where you started just now was so powerful. You said, we don't live in silos. Like we live in multiple worlds, right? The South is
Yeah.
actually multiple. We have different roles. We
Mm.
collect data differently based on what's needed. That's how we live. And I also know your work in both qualitative and mixed method studies, right? So
Mm.
you have all of this formal knowledge, but it seems as though the indigenous knowledge it feels like your baseline or your foundation, or your understanding of indigenous research. How has that informed your formal research training, and what's the relationship and interplay between the two?
Yeah. My understanding of indigenous ways of knowing and research methods has just made better my formal training. Because formal training is like they're giving you a template, just like a template. And in this template, you've got to fill it up with information that is going to serve you better when you go into the field. So knowing, for example, that when you go to collect data and work with a community, you are not just going to extract. It's not just about extracting. It's about learning from that community, letting them create their story, and most importantly, working with them throughout the research sessions, all of them, from designing, making decisions about what kind of questions are important to them. Some are not important. And I know this is a big issue that grant makers have. Because, when you're writing a grant proposal, they want you to say your objective, your question. They don't care about your community. And they never give you, most grant givers don't give you some little money for you to go to the community to find out what is important to them before you write your proposal. So many times you just write your proposal and then you go out with them. But what I've realized is that it's so important to work with communities throughout, from the beginning to the end. And even if you have your research questions already cast in stone, according to your grantor, there is still room whereby you can add a question that is important or an item that is important to the community. And I think if we have time, I'll give an example of how I did that once, which is so important, because otherwise you'll always come out with data, make interpretations that even if you took it back to the community for confirmation, they'll be like, really? Is this even useful to us? Is this even practical? Is this even going to work for us? So even if your grantor has tied your hands, still have time for the community. So I think my formal training is just important. It helps me know how the Western world, which develop those kind of trainings, thinks, but it's upon me to now teach that Western world what the local communities, how they think. And I think it's my duty to be in the middle there.
Oh, yeah. You're that conduit. I I really admire that sense of ethical responsibility to community, and also acknowledging that the grantor's agenda may not align with the community's needs, but
Yeah.
we're also negotiating those two things all the time. So I hear the ethical and the practical considerations that you have to put in place. You mentioned that you have an example of how you've done that. I would love to hear it.
Yeah. This is a project I did in 2019, 2020. And my grantor, it was a very small pilot project. My grantor was New York University. I don't know if you know Professor Hirokazu Yoshikawa. He was running a program that was giving small seed grants to the Global South researchers to conduct education research, find out how to make better education in Global South. So in this project, I wrote a proposal as any other, and I was just going to survey the indigenous methods used to teach and motivate children in home settings, and how some of it can be adapted into school settings, and how parents can also learn how children are taught and motivated in school settings so that they can use these at home to motivate the children. At the end of the day, the children are now, with the world going the way it is, you hand them over to the school. So it's important that they survive and excel in the school, because as the world is set up, they need to be a global citizen. They need to be able to get a job. They need to be able to make a living. They need to be able to, do all these things that we need to do. So parents also need to learn how the school motivates the children so that they can help the children at home with schoolwork. And the
Yeah.
school also needs to know how the parents motivate children at home so that they can use some of these methods to make school friendlier to these children, and especially in early childhood classes. So when I took this idea to the schools that I was working with, in a theory of change workshop first, before we started the research, they listened to me and they said, excellent, we don't mind. But there's something we want practically from you by the time you finish this project. And what they wanted from me, I could give. I'm so happy I could give it. They said, could you train the teachers that you're going to work with could you give them training in basic research so that when you go out of here, they can as well be conducting little action research on their own to make their practice better. Now, that was not part of the proposal, but it was something so, you work around with it by, like, for example, I just told the grantor, I told you, Professor Hirokazu Yoshikawa, Professor Paul Oburu of Maseno University, Kenya, Professor Robert Seppel of University of Zambia. I told them this is what I've been asked. And I think in the workshops that we make to train the teachers to collect this data, we can put aside 5 days or 5 mornings. We can put aside time to train the teachers on this, on action research, how to conduct research, how to recruit participants, how to analyze the data, what to do with it, and we did it. So it's possible to do that. So, when you write a grant, I suggest that if you're coming to work with rural communities the way I do, be open to this kind of suggestion. Don't just close up and say, oh, no, we can't do that. You want to be a friend to these people, and they are out there ready to be your friend. So it's possible to do this.
And I think it's so remarkable that the community also trusted you enough to ask for what they wanted. And it didn't sound like it was an ask. It was like, this is what we want.
Yes.
This is going to work. This is what we want. And a lot of times communities don't always feel that agency that they can insist on what they want, but it really makes for strong buy-in. We are both part of the Pan-African Mental Health Research Network, and we're very much committed as a global group to doing work that affirms Indigenous ways of knowing, that affirms community agency. And it's a consortium that's made up of many universities on the continent. In the UK, Nottingham-Trent University, and on this side of the saltwater, University West Indies in Jamaica, and University of Guyana. So that's how we know each other. So when I'm hearing you talking about your work in Zambia, in Kenya, and I want you to talk a little bit more about it, because I know you've done work around mealtime practices. And I'm hearing how the community is shaping your commitment, shaping your actions. Are there any tensions sometimes between quantitative indicators and qualitative lived experience in your work?
Yeah, the tensions are there. The tensions are there because with quantitative, you kind of get, you want to count without looking at the feelings or the person, the actual human beings behind these numbers. And that one is really strange. It's a strange way of doing things for Indigenous communities, because Indigenous communities are based on the person being very, very much important, and the person emotionally, physically, the person mentally, the space they occupy. It's so important. A mother, a father, there is so much that comes to this person. This person is a spirit, is a human being. But quantitative doesn't look at all that. It's okay. I'm not saying anything is less than the other, because, it's important to know that 20 people out of 30 had malaria. It's important to know that 10 of them had less malaria than others, because it will really inform what kind of treatment you give them and so on. But it's also important to have the background of these people. How did they come to have malaria? How do they feel about it? What do they think? How can we talk to them? For you to do behavior change, you know how difficult that is to make behavior change. So it's important to get things qualitatively. There is tension when I'm in these collaborative research groups and I have my quantitative colleagues. Sometimes when I bring in these stories, like, for example, in one of these collaborative work that I did, I was insisting that it was so important to have advisory board members from the community. And some of my colleagues were not seeing why. And I was like, no, we need advisory board members. And these are the members who need to really understand what our study is about. Because one, they'll be our advocates in the community. Two, they'll be the users of our findings in the community. So it's so important to work along with them so that they understand and they are there with you as this evidence is generated. Then they use it first. What is the reason why we do research? We do research, going back to the main reason, we do research to improve the human condition. Now, improving the human condition begins with the participating community. It doesn't begin with the readers of the manuscripts out there. It doesn't begin with the people who develop medicine out there. No, it begins with the community that participates. And how does it begin? Through advisory board members who are part of this research. They are the first one to see the kind of evidence emanating from these findings, and they're like, okay, so how can we do this? How can we improve this? How can we improve on this issue? I want to give one example of a project that I'm just completing right now, and just writing some policy and community dissemination documents. So we were working, generously funded by Templeton World Charity Foundation. So we were working with a community in Amhara, Ethiopia, a community in Bamenda, Cameroon, and the Turkana community in Kenya. And we were looking at how adolescents can be depolarized. You know, there is, in these three communities, there are different conflicts that polarize people, and adolescents are in the middle of it all. So among the Turkana, there is a lot of cattle raiding, livestock raiding. You know, livestock is everything to them. So when the drought comes, the floods come, many times there is talk by raiding neighbors, and it involves a lot of fatalities. And among the Amhara, there is this secessionist war by the Amhara forces, and many times these people recruit young people, adolescents, and children, because they're the ones who are there. They're the ones who are easy to convince. And in Cameroon, in Bamenda, there is the political, linguistic, religious conflict that has been going on forever. Here also, they recruit young people. So we based our study on these three conflicts. And in these three conflicts, we've come up with the rituals, how rituals can be used to depolarize adolescents. So we are writing policy briefs, very important for the policymakers, but much more important, community dissemination documents and other avenues, so that we take the findings straight back to the community. They really do need it, because even them, it's in their best interest that their young people don't get into these conflicts, because they keep on getting killed. So it's in their best interest. So they're very, very interested in this. Now, if we did not work with community advisory boards in these conflicts, I don't know how we'd count, how we'd collect, take our findings to the community. It's much easier now because the advisory board was there and they watched this project evolve. So when we have these workshops in the community, when we have the drama in the community and so on, we have the support. And that's why I think it's so important to work with the community together as you move on in research.
What a powerful example. And in that example, understand the responsibility. You understand what's at stake. Yeah, like the research is really there, can save lives. It's very powerful. One of these things I really love about the Pan African Mental Health Research Network is a space where, because we're coming from different orientations, but it's a space that really honors different ways of knowing. It's a space that facilitates mixed methods research in a way that pays equal attention and service to quantitative and qualitative ways of gathering data. So when you're speaking, I'm thinking about the ways in which different indicators make different things visible. I see that a lot in our work. So that the quantitative indicators are doing the work, but it's not trying to do the work of the qualitative indicators. Qualitative indicators are not trying to do the work of the quantitative indicators. And we see that with our colleagues in South Africa, in Zimbabwe, in Ghana, in Kenya, in Nigeria. So powerful. From the first time I met you, Pam, I've been taken by how you manage collaboration. You are involved and have been involved in large international multidisciplinary research teams. How do you maintain that ethical clarity as you're working with these large groups, negotiating politics and different agendas? What keeps you as a researcher, as Pamela? What keeps you anchored?
First and foremost, I think I should mention another privilege I have. My university, Kisi University, is very supportive of research. Very supportive. So that's one privilege I have, because I know of colleagues who have to juggle all these and juggle much, much more in the university. I don't have to do that. I teach, I supervise students, I do my community service, and then I dedicate a lot of my time to research. But it helps a lot to work with friends like you. Helps a lot to be in this collaboration with friends like you. It helps a lot to have one focus. And one of my underlined focus is human flourishing. So when I start from there, I see that all these collaborations, or the collaborations that I'm involved in, they're all just circulating in one place: human flourishing. What does it mean for a person to flourish? What do they need? Of course, they need to do well in school. They have to succeed in school. They need to be healthy physically. I'm just coming out of a big collaboration on non-communicable diseases, and especially diabetes and hypertension. So they need to be healthy. And it talked much about nutrition and child nutrition and support. What anchors me, it's multiple. It's my university. It's my family is very supportive of what I do. They're happy to see me do this. So I have friends all over, you, my colleagues, my university. I think just having a comfortable place to fall back in is really what gives me ability to do all this.
Yeah, yeah. And to be able to do the work you support is so important for you as a researcher, because it can be a very extractive, exhausting field to work in. So
Mm,
having that is really important.
mm.
What does it mean for you to produce research that's both locally grounded? From the get-go, we're hearing that it's locally grounded, but is also internationally legible. You're connecting the local with the global, and you do it so beautifully in the work.
Mm.
What does it mean to you to be able to produce that kind of work?
I think it's so important for me because, for example, working among the Amhara, working among the Nso in Cameroon, and working among the Turkana, it's so important for me to be able to present their thoughts exactly how they want it to be presented globally. And it's also important for me that globally people understand what I'm talking about. So standing in the middle here, it's such a rewarding space to be in, such a spiritual space. You go home happy, um, at least doing something so important for this community, and they're appreciating. They're appreciating. Hopefully, the global community does too. But according to me, I think it's much more important for me that the community that I work with appreciates and finds my work useful to improve their condition than even the global community. So if my work is not well received globally, that's not as important as if it was not well received locally. It's okay for me to cut corners globally, but not locally.
I hear that because you're accountable. You're accountable and you're responsible. Yeah. And you're also occupying the world of academic publishing, which has its own kind of standards, own kinds of teeth. What has been the biggest challenges and what has been the biggest learning in terms of academic publishing and maneuvering that part of the work that you do?
Yeah. One of my main challenges in academic publishing is that many of the top tier journals don't like qualitative work. And then many of the top tier journals have got very strict guidelines on how some things are done. For example, how consenting is done. And yet, when you're working with local communities where literacy levels are very low, where, you have to look for creative ways to consent. For example, the first time I worked with the Turkana is when I learned how to do a consent working with the local chief. So the chief would we would have a local Turkana research assistant help the chief understand what our intention is. Then the chief would explain to the community or participants what the intentions are and ask them, is it okay? And they would say, okay. But that one, when now you go to these top tier journals, they don't want that. They want consent to be stamped or signed or, things like that, which is not possible. So some of those small things are impediments in publishing in these top tier journals. But it's liberating to know that there are other journals that accept this. So you don't always have to go to the most top tier journals. I've published there before, but I don't feel so bad nowadays if my publication is rejected there and then I have to do it in another place. That's still okay with me. It's still okay.
Yeah. Has that been a journey to get there though? As academics, that whole publishing and dealing with rejections, I feel like we need to find another word. We shouldn't call it rejections, returns. The word rejection is so strong. Yeah. And you get, and it says rejection, right? So you get this thing that says rejection. And of course, the longer we stay in this field, the more we learn to depersonalize that has nothing to do with me as a individual. But it's so frustrating when that is tied to basics of consent, which is not transferable between settings. It absolutely isn't. I heard you say just now, you said, it doesn't bother me as much now. What has gotten you to that point where you can be like, oh,
Um, I think once you get when you start getting comfortable and satisfied, I think it's the satisfaction with what you're doing. You get really comfortable that some things don't bother you so much. I imagine a young academic coming in and small things would bother them. But the more you stay in the field, and then you get so much satisfaction working with these local communities, you get comfortable.
mm. I, I'm sitting with that for a minute because I think that's one of these themes that has been coming through this conversation. Um, that obligation to community, the fact that their opinion of our work matters and matters more. And sometimes we're not romanticizing it either, right? Because we still need to get published. We need to get access to grants. The Pan African Mental Health Research Network has a strong commitment to early career researchers. For them to hear that, I think is so important.
It's important.
The things I like about PAM is that as though as a group of seasoned researchers, they're saying, this is what I wish someone told me. And I was just coming in.
Earlier.
Yeah.
Yeah.
Yeah. And even when you presented with the early career researchers in South Africa, I see that energy. Let us share with you what we wish someone would have told us and make
Yeah.
space. There's that commitment to youth as well. And that's a responsibility. That's a
Oh, yeah.
responsibility.
It's a
Yeah.
responsibility.
So I'm hearing a responsibility to our participants and a responsibility to our younger colleagues as well. Yeah. What are the responsibilities do you think that we have when we do work that's really based in environments that have a lot of structural vulnerability?
There are some of these structures that you won't survive if you don't observe them. You've got to observe some of the rules. But I think it's important to be creative in negotiating your space in these structures. So there is always a give and take. And I think researchers, early career researchers, and even us, we need to find out what are these points, inflection points, that we can add onto something, or we can blend the structure a bit so that it's not debilitating for your work. And yeah, I think you should always be on the watch out for that, look out for that, so that you see what is it can I add, what is it can I lessen, but still be able to be working with the rules.
Yeah, you're speaking to the fact that you need to be adaptable, but need to be creative and open to pushing walls. Yeah.
Yes.
As we start to close up our reasoning today, when you think about the future work, the future interventions that you want to be involved with, how do you see yourself continuing to grow as a researcher? How do you see yourself continuing to contribute to understanding mental health and emotional health issues in urban and rural areas on the continent?
I'll define my growth by how much I've been able to produce in the field. For example, do I have early career researchers that I've been able to work with successfully? I've learned from me something. Is there, for example, Panham, we want to see how Indigenous healthcare providers can work with the biomedical providers. So, one success would be if this is in practice, because I know it's all in paper somewhere. But if we can see this in practice, that would really be a success. And then generally, what is the effect of all this in in community flourishing, individual flourishing in the community? So I would count my growth as how much have I been able to impart to researchers coming up behind me and the communities that we've been working with. Has anything changed from the kind of findings we've had or the kind of interventions we are doing? Anything changed? And if it has changed, then that is a huge success. Sometimes you see it in a lifetime, sometimes you don't. But if there are indicators that it's going to change, that is really good. It's good enough.
As we close, is there anything that you feel like that we need to understand that I haven't asked about the work that you do and your trajectory as a researcher?
Maybe not really the work that I do, but the important part about mentorship. I am a product of many people. My hand has been held by whole communities. My hand has been held by different researchers ahead of me. I just mentioned a few of them. Maybe I could mention them again. Professor Guru of Maseno University held my hand. Professor Hirokazu Yoshikawa of New York University held my hand. Professor Robert Seppel. So really, what I'm trying to say is that a researcher is normally a product of a whole college and school of people, communities and other researchers, Tracy, Panham, and everyone. So it's important to be able to get into a community that is supportive, and that either makes or breaks. If the community that you get into as a researcher either makes or breaks you, supportive community, you flourish. If you happen to enter one that is not as supportive or a situation that is not supportive, you do not flourish. That's the only thing I can add.
Pam, what's beautiful about speaking with you is that like all the parts of you connect. How stopping to say, listen, there's so many hands that help me to get there, and making sure to stop and name those people who have contributed towards your success. The proof of your ethos is in how you live. It's how you think about yourself as being held up and how you think about your obligation and your commitment to holding up others. It's so beautiful to sit with that energy and that presence. Thank you. As we close, I keep returning to one of Pamela's clearest commitments. Research is accountable first to the communities who participate, not to journals, not to distant readers, but to the people whose lives and futures are at stake. Across this conversation, Pamela offers us a way of thinking about rigor that is ethical, She shows how community-based work can remain locally grounded while still being internationally legible, and she names the real tensions that show up when academic publishing standards fail to translate across contexts. What I appreciate is that she does not romanticize the work. She acknowledges the structures. She also insists on creativity, finding the inflection points where researchers can negotiate space and make research more responsive without abandoning responsibility. Scholarship is never solitary. Mentoring is infrastructure. She names the people and communities who held her hand, and she frames flourishing as a collective, the flourishing of children, families, communities, and the early career researchers coming up behind us. So if you are listening as a student, a practitioner, an academic, or a community worker, I hope you leave with a sharper question. What does it mean to produce evidence that improves the human condition, beginning with the participating community? Thank you for listening to Saltwater Reasonings. And remember, you can learn more about Pamela's work by visiting tracyrogers.com. If this episode stayed with you, share it with someone who is thinking about method, ethics, and community accountability. Until next time.